Here's Monica Kubizniak talking about irritable bowel syndrome and the low FODMAP diet. Go on.
Irritable bowel. It's not a nice topic and a lot of people find it difficult to talk about, but it is something that is happening a lot in our community and is really worth talking about because there's a lot of dietary strategies now that we can actually implement to help people manage something that can be really difficult and quite debilitating. So a lot of people know a little bit about irritable bowel. Most people know somebody who's affected, and there's a lot of things that can affect the bowel. We know that lactose can be a problem for some people, gluten and wheat can be a problem for some people, caffeine, spicy foods, and you hear people throw around some of the things they think are triggering off their gut symptoms, which could be anything from wind, bloating, diarrhea, constipation, pain, nausea, and anything from once a week to a daily event or even after each meal. So what I'd like to talk about is something called the low FODMAP diet, which is coming up in research a lot, and especially in the last 3 to 4 years, it's really making headway in a dietary strategy for managing irritable bowel. And it brings together some of the conventional triggers that we know can affect people, such as lactose intolerance and gluten or wheat intolerance, but it goes a little bit further than that. And basically FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides and polyols. And what these are dietary sugars, or a group of dietary sugars that can be incompletely absorbed or malabsorbed by sensitive individuals, where in the gut these sugars don't get processed properly and then ferment and cause all of these very uncomfortable symptoms such as bloating and wind. And for a lot of people, they get quite surprised about the type of foods that FODMAPs are connected with. So what we do as a dietitian, if I have somebody with irritable bowel, we would go through what we call a low FODMAPs diet, or the equivalent to a bit of an elimination diet, and we remove foods that are high in these FODMAP dietary sugar type foods. And obviously for a lot of people that's lactose and gluten and wheat, but it's also foods such as apples, pears, mangoes, onion, asparagus, lychees, nectarines, plums, cauliflower, snow peas, mushrooms, and the list goes on and on, even watermelon. A lot of your fruit juices, dried fruit, that can actually irritate the bowel. And a lot of people wouldn't connect their bowel symptoms to an apple because of course an apple a day keeps the doctor away. But unfortunately for some people, if they are a fructose malabsorber, then an apple is actually going to cause a lot of uncomfortable symptoms for them. And if in a day you're eating several of these foods and you are sensitive to more than one of the dietary sugars, then you will be experiencing irritable bowel type symptoms from possibly when you eat breakfast to when you go to bed. So for most people, going on a 2 to 4 week elimination of foods high in FODMAPs can really help settle symptoms. Unfortunately with irritable bowel, it's very hard to cure 100%. But if you get an up to 90% reduction in symptoms, for a lot of people that means a new lease of life. So if we can really get symptoms settled in somebody with irritable bowel using FODMAPs, we can then challenge each of those dietary sugars individually and separately so we can see what the triggers are. And there's a specific challenge process with each group so that we are isolating only one sugar at a time to see if it causes the symptoms that that person usually experiences, such as bloating or wind or loose stools or constipation. Once that's occurred, most people have a tolerance level. So after the challenge process, we reintroduce all of the foods that are not problematic, and then we actually look at tolerance levels for the foods that are problematic. And for most people, they will be able to eat these foods in some capacity. meaning that they have a good variety of food, they have balanced diet. We can look at ensuring that all the nutrients are obtained in the diet, but at the same time relieving symptoms up to 95% in some patients. So the FODMAPs is really useful. If you haven't heard about it, I encourage you to spread the term around, because for somebody who hasn't heard of it that is experiencing irritable bowel symptoms, and it's possible that their life is being restricted because they're too worried about how they feel with their gut, then this could just be that picture or that piece of the puzzle that they didn't quite realise they were missing on, and it could really help them feel much better.